we've had our third Sydney Summit. It feels a little bit like deja vu, but we've come a long way over the last 2 years, and to be joined with business leaders in the city, as well as the council and local members and ministers of the government, as well as other members of the public service, to brainstorm and think of new ideas in which we can reinvigorate the Sydney CBD as we move through this phase of the pandemic. And the reason we've held our third one is because we know it works. We held the first one after Alpha, the second one after Delta, and the third one now as we move through Omicron. And each and every step of the way, when we've gone through these difficult times, we've collaborated, put a range of ideas on the table. We've worked closely with the council, and those ideas have ensured that we breathe life back into the city. And we know that over the last 2 years that we're in a much better position today than we were after those last two outbreaks. We have a highly vaccinated population. We've seen here just over the course of the week, international borders are about to open. Life is coming back. We have made enormous inroads as a people over the last 2 years. So there is a lot to be confident about. And I think getting those ideas on the table, bringing people together in the way that we've been able to do so over the last 2 years will ensure that confidence comes back rapidly. And that's what we've seen over the last two outbreaks, and that's exactly what we're going to see again. We know that when Sydney goes well, the state goes well, and our nation goes well. We've led our country through this pandemic here in New South Wales, and the response in Sydney in bouncing back after outbreaks will ensure that New South Wales comes back stronger out the other side. And we'll do so together. We've done that in the past. And I have complete confidence, based on our success over the last 2 years, that sustained success will be with us moving forward. There are a range of ideas on the table, from transport to festivals and to events. I think what's different this time, we look at the last two outbreaks, we were very much focused on the here and now. And the clear thing that's come through today is not just the focus as we move through this period, and whether it's a 10 or a 20-day campaign to bring people back to the office, to bring events and festivals back, to get rid of the red tape and regulation that constrains businesses. Just down here in the rocks, one of the ideas we had last time was to do more al fresco dining and get government out of the way. It's now a permanent feature of our city and state. So, but what really came through, I think, today was, yes, let's have a short-term campaign. Yes, let's get festivals and events going. But what is the long-term plan for our city? What's the long-term vision? And setting that out, bringing these ideas to the table. And I see events like this, summits like this, as now a permanent fixture on the calendar. And hopefully at the next summit, we won't be talking about an outbreak. We won't be talking about getting people back into the office. We'll be talking about the long-term vision of Sydney going forward. So I want to thank everybody for their participation today. The Treasurer will have something more to say in relation to the summit this morning. But overall, I think bringing people together, working closely with the council. We haven't always seen eye to eye, as you know, with the council, but I think over the last 2 years, we've had an incredibly constructive dialogue and work together for the benefit of our state. And I have complete confidence that Sydney is going to go back to not just where it was before, but come out incredibly stronger at the other side of this pandemic. And it's going to be boom time in the Sydney CBD as we move through. Today, we also release where we're tracking on the modelling, the health modelling, and can I once again say the information we're releasing today is once again incredibly pleasing and should be very reassuring to people across our state. We continue to track very well. Now, when you remember and you recall the best case, middle case and worst case scenarios, when we released the best case scenario, so when we released those scenarios, under the best case scenario with ICUs, we were looking at 270 at a peak. This is the best case, this is not the worst case, best case, 270 at the peak. We actually hit 217, so well below where that best case was. And for context, under Delta, we had 240 people in ICU. Under the hospitalisations, we predicted under the best case 3158 hospitalisations with COVID, and we hit 2758. So very pleasing. Obviously, as we always say, that does not mean our hospital system has not been under pressure. It's been under significant pressure, as all health systems around the country and around the world have been. I want to thank our frontline health staff, our nurses, our doctors, our paramedics, everyone involved in the health system. It's been a long, and hard and tiring 2 years. But our state continues to stand tall because of the efforts and the sacrifices that our frontline health workers have made day in, day out. This result that once again we've released today is a testament as well to the investments we've made in our health system, not just at the outset of the pandemic, but over the last 2 years in building up capacity. So I want to thank our health teams and everyone for their work. I also, before I finish, and I'll pass to Dr. Chan, before I finish, I want to make a point about boosters. It's pleasing to see above 50%, that number is continuing to increase. We launched our booster a month yesterday, and that means that on weekends, over the next month, you'll be able to walk in to any of our 40 centres. We really do want to get that booster rate higher. I know people are tired. I know it's been a sustained effort over this period of time, but that effort, as you can see in these numbers, demonstrates that vaccination rate, 95%, that booster rate, that high booster rate, clearly demonstrates that will put downward pressure on hospitalisations, ICU presentations, and death. So just ask again the people of our great state, continue that effort, we can get that booster shot up. That's going to protect yourself, your family, and your friends from Omicron. I know it's been a long haul for 2 years. You can certainly see the light, but the effort just needs to keep on going. And I want to thank you for everything that you've done. I'm now going to pass it to Dr. Chan for the public health update. Susan Pitts will give an update in relation to the modelling and how we're tracking. Then the Treasurer will give an update in relation to the success of the summit and what's next in terms of getting these ideas and turning them into a reality. And then Jennifer Westercott from the BCA will talk about her experience and the importance of breathing life back into the CBDs across our state.
So there are currently 1,716 people are in hospital, including 108 in ICU, of whom 48 are ventilated. And it's pleasing to see those numbers continue to decline. Of the 8,950 positive test results, we've got 5,289 positive rapid antigen tests and 3,661 positive PCR tests. The 3,661 positive PCR results were returned from 44,172 PCR tests. Sadly, we are reporting the deaths of 19 people with COVID, 14 men and 5 women. And of the 19 people who died, 2 people were in their 50s, 1 person was in their 60s, 7 people were in their 70s, 5 were in their 80s, and 4 people were in their 90s. Can I just express my sincere condolences to those for the loss of their loved ones. Today we also take the opportunity to give some more in-depth understanding of those who have died and the characteristics in terms of vaccination and underlying health conditions. So in the period to the 4 p.m. on Thursday the 10th of February, we have recorded 141 deaths, 52 women and 89 men. 5 were in the age group 40 to 49, 3 were in the age group 50 to 59, 16 were in the age group 60 to 69, 34 were in the age group 70 to 79, 47 were in the age group 80 to 89, 35 were in the age group 90 to 99, and there was 1 person over 100 years of age. So of the 141 deaths, 32 were not vaccinated. 2 had had 1 dose, 75 had 2 doses, and 32 had 3 doses. 53 of the deaths occurred in residents of aged care facilities, and 11 were not vaccinated. 1 had received 1 dose, 23 had received 2 doses, and 18 had received 3 doses. There were 10 deaths in those under 65 years of age, 5 in their 40s, 3 in their 50s, and 2 in their early 60s. And we've been classifying and categorising the information from medical records to just better inform the public and the community about the risk factors associated with those deaths. And just to clarify that people might have multiple of these comorbidities, what we call those underlying health conditions. So 2 people had diabetes, 1 had cardiac disease, 4 had chronic pulmonary disease, chronic lung disease, not asthma. 3 had asthma. 2 had significant immunocompromise. 2 had significant renal disease. 2 had cancers. 2 had obstructive sleep apnea, and 1 had a chronic neurological condition. 4 were unvaccinated. 4 had 2 doses of vaccine, and 2 had 3 doses of vaccine, and 2 with the 3 doses had significant pre-existing comorbidities. In terms of the place of death, 9 people died in hospital and 1 died and was diagnosed at home in a post-mortem diagnosis. So that gentleman was a gentleman in his 40s, and it was diagnosed following the referral to coronial system. Can I just sort of re-emphasise that COVID is a serious disease across all age groups, so continue to get tested and get linked to care. Be aware of the signs your conditioning is worsening, and we've got some really practical information on a fact sheet called Testing Positive for COVID fact sheet. So please Google that if you've got COVID. You should be sent the links when you get that notification. But I would urge everyone to get tested. There are treatments available, and it's really important that people are linked to care. Notwithstanding, as a public health person, I also enjoy seeing the data in the age distribution, but it's really important people are linked to care to both get access to the antivirals and other therapies, and so they know where to escalate their concerns if their condition deteriorates. Thank you.
Well, as Premier's noted, we had our peak of cases in hospital on the 24th of January, and what a January it was for our hospital system. Can I again thank the health staff right across New South Wales who have worked so hard to manage these hospitalisations. It's very pleasing that we never reached the peak of even the most optimistic scenario that we modelled. And that includes for ICU as well, as the Premier's noted, which actually peaked a little earlier than hospitalisations on the 18th of January. What we're seeing at the present time with the model is that the cases are coming down, and they're coming down more steadily now, which was really good to see. They're coming down a little slower than our modelling predicted, and so they remain above the optimistic line in respect of the hospitalisations. But what we've been doing in the last week or so is having a look, and we've had an expert clinical panel review how we capture COVID admissions to hospital. What we realised here in New South Wales that we had a very conservative approach to that capture, and we were back capturing people coming into hospital who, and I think I touched on this a couple of weeks ago, so incidental COVID. Back capturing all the way back 28 days prior to admission, and what that meant was that in our numbers we were getting a skewing of our data. So for example, if you were 22 years of age, you had COVID 3 weeks ago, you recovered from that, fell off your bicycle, broke your arm and came to hospital, we would count you as a COVID admission. After the review by our expert clinical panel, we've now reduced that back capture to 14 days to provide a more realistic picture of what we're seeing in our hospitals, and our numbers reflect that. But on any scenario, whether it's 28 days, 14 days, or whatever the number you use, the trend is the same, and in all cases those numbers are following the same path down. I will also note that in New South Wales that back capture exists. That does not exist in other states, where you would only be counted if you were COVID positive at the time of your admission, unless otherwise clinically determined. So, once again, as I say, this has been an enormous effort by our health system. Can I also acknowledge, though, the people who have worked in the community setting to care for tens of thousands of people who have had COVID and managed that COVID safely at home. We have had a health team dedicated to making sure that people could access the care that they need, and our local health districts have established protocols and processes that I think will stand us in good stead, not just for what we've just experienced with COVID, but for going forward as well. Some of the aspects of COVID, whilst most of it has been incredibly difficult, will see us well into the future with new ways of doing things and thinking about how we approach our health system. The Premier's mentioned our booster program again. Please can I remind everyone, we have opened up all of our clinics. We've got pop-ups all over the state. Please walk in this weekend. If you haven't had your first dose, you are very welcome to come along and get that. Children, families, everyone can come together. Our doors are wide open. Please take the opportunity this weekend and across the next month to get your vaccination, even if it's your very first one. And of course, for those boosters, very importantly, we'd love to see you.
Well, today's CBD Summit demonstrates the government's commitment to get people back to work safely and to get our economy roaring. We know that our CBDs are vital to the success of the New South Wales economy. In fact, the local government area in Sydney contributes a turnover of about $130 billion per annum, or 21% of the state's output. So we need to get our CBDs going if we're going to see our economy get back on its feet and roar into the future. We today heard from a range of community and business leaders about their ideas to revitalise our CBD and do things differently. We know that the challenges of COVID, some of which will be temporary, those temporary challenges will be removed when international students come back, when borders are open, tourists are coming in. But we also know that there are some structural challenges that we need to address as well. Rather than fighting the tide, we need to ride the wave. We need to be doing things differently in our CBDs. That looks like changing our planning laws. That looks like removing red tape. That looks like providing more incentives for people to come into the cities, cultural and artistic events that would be drawcard events for people to get into town, spend money, support the small businesses that make up the majority of businesses in our CBDs, and help our economy get back on its feet and bounce back better. I'll now hand over to Jennifer Westacott to talk a bit about the summit.
Thanks, Treasurer. Well, the Premier's CBD Summit today has been a great success. Lots of practical, implementable actions. It shows the New South Wales Government leading again, bringing business, community together to say, how do we get our CBDs to thrive? How do we do that in a way that is safe? And if we do that, it means that small business gets back up on their feet. It means that people start working together again in teams, getting our industries going, getting those new jobs going. It means our tourists come back, driving our hospitality sector. It means our cities are safer. It means they're great destinations, but most importantly, it keeps Sydney as the great, iconic, global city on the map. And today, some practical things, a sustained campaign. We've got to sustain this as we roll through this virus in its various ways. Real action by business and government, getting people back, working together, making sure that we get rid of some of the confusion around what people need to do and keeping people working flexibly. Business needs to lead on that and show some leadership, and we'll get people working together again. And some really practical things about making sure that we incentivise people, getting them out to local restaurants, looking at our retail trading hours. Really practical things were outlined today. And again, New South Wales Government leading the way, getting our economy thriving, keeping our community safe, and making sure that New South Wales stays the iconic state and Sydney stays the iconic city that it always has been.
So, Premier, are you going to start by lifting all the restrictions on the 27th or 28th?
Well, obviously we'll work through that. We've set the date as the 27th of February, and that's the right approach to strike the balance. What we're working through today, through summits like this, is to ensure that when we do lift some of those restrictions, obviously the most pertinent ones when you're talking about the Sydney CBD are the stay-at-home obligation and obviously face masks in the office. So obviously they were topics on the agenda. But ultimately, this is about ensuring that when we do open up and we work through this period of time, we come back strongly. We come back strongly, not just for the short term, but for the long term as well. As Jennifer spoke about, this is about sustaining our city's success into the future. It's not just about the short term. Now, we had some great events. We learned a lot last year. They were great events. When we closed George Street, had long lunches and picnics in Darling Harbour. We had more cultural and artistic festivals partnering with the council, but we have to do that in a sustained way. We need to have like a calendar of events in the Sydney CBD, not just for the weekdays, but for the weekends as well. There shouldn't be tumbleweed rolling down Martin Place on the weekend. It should be thriving and bustling with people and cafes and restaurants being open. So if there's anything we can, the economic silver lining out of the pandemic should be about bringing action back to town, making people want to come to the Sydney CBD on the weekends with their families, because there's things to do. One thing we have that you can never take away is our beauty. We have the most beautiful harbour anywhere in the world, the most beautiful city anywhere in the world. People want to come. You can build on beauty. That's exactly what we've been doing. But at the same time, it's festivals and events and cutting red tape and allowing people to sit outdoors and al fresco dining. These are the things that can take our city from good to great. So yes, we want people to come back, and we'll be doing a short-term campaign, partnering. What was really important, what I really took out today was, in the past, when we've had these summits, business leaders and community leaders have said, well, what's the government doing? Government should do this. Government should bring the public service back. Government should give us further incentives. Today was different. Today it was the business and community leaders who actually took the lead, and they said, here's what we're going to do. We want to incentivise our people coming back. We want to partner with the government to achieve these things. And to me, that was the most inspiring thing of this morning. I remember doing the first one on Alpha. It was a complete complaint fest, right? It was everyone's like, here's what the problem is with the world. Here's the problem with the city. Here's what the government's doing badly, and here's why the world is going to end because of COVID. We got to Delta. There was a lot more inspiration and ideas based on the success of the first summit in terms of what we'd implemented from the ideas that came about. But to see the transition, and this time it's like, this is a partnership. It's a partnership between the state and our people, community and business leaders coming together. It's our obligation to make our city great. And that's exactly what we're going to do. And I think we can learn from the past, learn from what worked last year, learn from what didn't, but make these things permanent. And success is going to be people coming back into the Sydney CBD, even with flexible work hours, even with the situation where employers provide flexible opportunities for their employees, because the city is the place that people want to be. And if we achieve that, that's going to be great for our city, great for our state, and great for our nation.
Just
Just
to clarify on that last question, there's 4 basic restrictions that are still in place in New South Wales.
Yeah.
Is your plan currently to take them all off, or are there some that you're considering leaving in place?
That's a matter for cabinet. And ultimately, our focus, as I've said from the outset during this period of time, is I had 2 key priorities. One, getting kids back in the classroom safely, and secondly, bringing back non-urgent elective surgery as quickly as possible. But they are the focus of the government. Kids going back to school, in my view, has been a success. It was interesting hearing the other premiers around the country yesterday at National Cabinet, Dan Andrews, saying what a success it had been in Victoria, Andrew Barr down in the ACT as well. We've achieved that. Long way to go. Appreciate there's going to be inconveniences. Continue to ask patience of our parents and our teachers, but they're doing a great job. Non-urgent elective surgery, we brought that back in the private health system. I know from my discussion with Susan that we continue to work with our local health districts to ensure that we can bring that back quickly. That's the focus for the government. But also making sure that when we do lift those restrictions, we come out firing. We came out firing after Alpha, we came out firing after Delta, and we're going to come firing out again here after the Omicron outbreak.
Premier, we just...
So you mentioned how you will be revitalising the Sydney CBD. What about the other CBDs, such as Parramatta?
Absolutely, same principles apply. In fact, that's exactly what we saw last year. In fact, if you talk about public servants coming back into the office, our largest footprint is at the Parramatta CBD. So we had people today from Western Sydney. I mean, what works for Sydney, the Sydney CBD, works for the Parramatta Sydney CBD, Parramatta CBD. It's the same principles. And what we actually did towards last year was, in terms of events and working with the councils, we mirrored that in Parramatta. There was a great lunch that we held when we closed George Street and stopped the trams coming down over late last year. We replicated the same event at Church Street in Parramatta that we had on George Street in Sydney. So these are great events. They bring life, excitement. And I still remember, we've gone through a tough summer, but that lunch had a Sydney 2000 feel about it. People happy in the best city, in the best state in the world, and it's going to happen again.
Premier, we just heard the latest numbers from Dr. Chan. 25% of deaths occurring in an aged care setting in New South Wales. Has the federal government failed residents in aged care?
No. I think obviously there are more challenges in aged care, and it is not simple. So I actually sympathise with the work they're doing. I know that they're making substantive efforts in relation to third dose vaccination and potentially fourth dose vaccination in aged care facilities. But it's a challenging area, and there's no doubt that COVID affects the elderly a lot more than it does for younger people, not exclusively. We have always said, Kenny, that if we can provide further support to the system, we stand ready to do so. Ultimately as well, from our perspective and with our areas of responsibility, we have capacity, as Susan said. Walk in this weekend and get a booster shot. We have the capacity, we'll continue that work. If there's assistance that we can provide to the Commonwealth, if they need it, we will. But it's not as simple as saying as well in aged care centres that boosters aren't at the level they meant to be. There's a whole lot of other range of factors when it comes to care, when it comes to family decisions that need to be taken into consideration. It's deeper than just the numbers that are read off the
Just
page.
working from home, Jennifer was very clear on the panel that working from home guidelines need to end. She's a little confusing, especially for multinational companies.
Yeah.
And the Ministry wants the public service back at the same time on the same rules. So will you change those two things together? And when people expect to be ordered back to work on public service?
Yeah, so I would expect we'll do it together. I think that was very clear today. We need a joint campaign from the government and the private sector and make it very clear about what we're trying to achieve here. So that was very clear today. There's a lot of ideas that came through on a whole range of areas and a whole range of issues, just like we did after the last two summits. Over the next week, the ministers will get together, we'll go through them line by line by line, work through what we believe is achievable, and then make a government decision off the back of it. And in terms of timing, that's a matter for government. It's not a matter for, no Matt's here, but that doesn't make a cabinet. We will go through the ordinary course those decisions and make them. But ultimately, what I can say to answer your question is we'll do it together. This is a partnership, and we're going to achieve those outcomes in a unified way.
Ramagi has changed its advice on vaccinations and move away from the words fully vaccinated
Yeah.
up to date. How are you going to mandate booster shots for essential workers?
So, well, we certainly, as a result of National Cabinet, will be applying third dose requirement in aged care. So that will apply in New South Wales, and we'll work through those other areas of essential workers in relation to a third dose. Now, I actually like the term that was used yesterday, up to date. That's the narrative we get. It's something that parents are very familiar with when we're vaccinating our children. Are you up to date? And I think that's important, but we'll work through those issues. We agree with the federal government in relation to allowing international arrivals and tourists on 2 doses. That makes complete sense for us, and so we support that. But we'll work through from a cabinet perspective. I'll take health advice and obviously consult with the health minister in relation to those specific areas where we have mandated a 2-dose vaccination as we move through this next phase. Certainly in relation to aged care, we adopt the principles of yesterday being 3, and certainly in relation to international tourists arriving on the 21st of February in our great state, it'll be 2 doses, and we'll continue the approach we've taken in the past.
The Nurses Association has been very critical of your decision to lift restrictions on December 15 during the inquiry this morning. They've said the hospital system wasn't prepared. Nurses have been left with heat exhaustion, dehydration and vomiting. How do you respond to that?
Well, obviously, it's been a very difficult year, a difficult 2 years for our nurses. They're incorrect in relation to their position. What we've seen, and you look at the numbers and you look at the facts, we've seen Omicron be incredibly highly transmissible, not just around the country, but around the world. There are health systems that are under pressure right around our country. That is, they are facts. This is a 100-year pandemic. Clearly, it's going to be difficult for our health staff. We want to provide them as much support as we can. When you look at the impact on our health system here, on figures alone, it's in a much better position than any other jurisdiction around the country, except Western Australia. But obviously they'll have their challenges when their borders open. The reality is, we know our nurses and our frontline doctors, our allied health professionals, cleaners, paramedics, O call operators. They've done an amazing job over 2 years. It's clearly being a challenge going through this pandemic, and it's going to be a challenge as we move through the next period of time. There are likely to be further waves of the virus. As we head into winter, that will provide even further challenges for our health system. This pandemic is not over. We have to learn to live with it, as we've been saying for 2 years. We need to move forward. I appreciate the sacrifices, ongoing efforts that our health staff make day in, day out, looking after and providing care, love and support for people in our health system. I understand there are challenges. They're not unique to New South Wales. They're not unique to Australia. They're not unique to the world. But they make an enormous effort day in, day out, keeping us safe. And for that, we're very grateful.
Premier, working now with Victoria and Queensland, how soon will the cruise ship industry is back to safety?
Well, we'll work through it. I mean, we appreciate and acknowledge the Prime Minister's decision yesterday in relation to the Biosecurity Act. But in addition to that, we thought it made most sense for the Eastern Seaboard states to work together with the industry on those guidelines. So we will have Queensland, Victoria and New South Wales health teams working closely with the industry, just like we've done over the last 2 years with COVID-safe plans with businesses as we've opened up. So I don't want to put a date on it, but what I want to say is obviously we want the cruise industry back as quickly as possible in a COVID-safe way. That's the focus.
What are you looking to be doing from the summit today? Some great ideas. What do you want your government to implement, as soon as you can? Is it free trams, longer trading hours, and separately on the by-election? How worried are you about losing the weekend?
Okay, so we'll do it the first question. So there's so many different areas that we cover. From cutting red tape and regulation, giving business greater flexibility, increasing hours, increasing trading hours. In relation to transport, we've considered providing free transport, I should say discounted transport in the past, arising out of these summits. I'm getting convinced today that this could be a way to go. I remember the former Transport Minister wasn't too keen when he was away, and I announced after the summit that I was looking at it. But he's now off, so we've got a new Transport Minister. I think he's a bit more supportive. But what I want to see is partnering with the business community in the Sydney CBD, is people coming back to town, using public transport, getting back into the office, and we want to draw them back in through events, through festivals, working with the local councils. We want to make sure that as we approach the end of February and into the start of this year, which is really when Sydney gets going, it gets going well. So everything's on the table. There were so many ideas that were brought forward today. And our track record coming out of these summits is delivery, because so many of the ideas we've had in the past, we've sat down and we've implemented, and the world didn't end. In fact, it actually got better. You think about some of the restrictions in the Sydney CBD in relation to trading hours, in relation to not being able to dine outside, not being able to stand up, having a drink. When we changed all of that, if we tried to change that before the pandemic, we'd have protests from local communities here. Now everyone loves it, and Sydney is better off for it. So we're going to be successful, just like we were over the last two. The Treasurer and myself and my ministers will be sitting down over the course of the next few days, go through the list, we'll see what we can do, and we'll implement it. But importantly, as Jennifer has said, in partnership with business. Government can't solve these things alone. We do it together. When we do it together, our city will be better off. Big is going to be tough. All the by-elections are tough. No government enjoys going through by-elections. They are difficult. They are always difficult. But ultimately, we've got great candidates in each of those 4 seats, and we've got a strong track record here in our state. We have led the nation through this pandemic. And the reason we've been able to do that is because of our strong track record over now 11 years, close to 11 years in government. You look at, when I sit in National Cabinet, I look at the health systems. I'm very proud of the fact that New South Wales is the strongest health system by a country mile. You can see it. And you can see it. And that doesn't get reported because that's good news. And that's not the business of the media these days. But that's the good news. And that happened because of the billions of dollars of investment we've made since coming to office, building up the health capacity system, building up ICU and the hospital system across the board, from the city to the bush. And Labor like to winch, Labor like to complain. They'll oppose every decision we made to turn around the state's finances from the train wreck we inherited. But because of that strong fiscal foundation, we've been able to invest significantly in our health system, significantly in infrastructure across the state. It's ensured greater opportunity and prosperity for people right across New South Wales. We have a good story to tell. There's a reason why we're not throwing significant amounts of money at the by-elections. It's the wrong thing to do that. But I'll make this point. We're running on our record. We're running on our record of substantive investment. When I was down in Bega, I was out at Maroubula Airport, which is closed, and there's inconvenience associated with that. But why is it closed? Because we're expanding it. So there's greater tourism opportunities in that area. I went out to Bega Fire Station and handed over keys to 2 new vehicles because of our substantial investment in a community that's been devastated by the bushfires. I then went down the road from there, 5 minutes down the road, and did the first sod turn on a new police station, $15 million police station that we're building in Bega. We're just getting on with the job, building a brighter future for our state. And Labor will complain, Labor will win, but that's the approach that gets nothing done. And what we saw today is people who are inspired to make a difference. We will continue to be optimistic. We'll continue to drive our state forward. We'll continue to invest for the great people of our state, not just for today, but to set it up for success for generations to come. I want to talk about infrastructure because whether it's in Bega, whether it's in Monero, whether it's in Strathfield, whether it's in Willoughby, there are cranes over the skies that wouldn't be there if Labor were in. So my clear message to people in those communities, back in our track record, back in a track record that delivers, back in a member who will sit as part of our government, continuing to advocate for further investment in those seats, as we're seeing in every single electorate across New South Wales. And don't forget what a Labor government actually means. Do nothing, deliver nothing approach to government. And that's the Labor way. They'll always be there opposing every project, oppose the M2, oppose WestConnex, oppose hospitals. They opposed the Tweed Hospital when we went out to build it. This is the approach that plays petty politics above better public policy. We'll continue to deliver for the state, and I expect that our members, if they're elected, will continue the strong track record of the great members before them. And look at them, Andrew Constance. Sorry, I know you're trying to get it, but we're on the run. Look at this won't get a run, I know tonight because it's good news. Andrew Constance, and I want to thank. I think it's probably appropriate today to thank them. Former Premier Gladys Berejiklian, who served the community of Willoughby for many, many years, and went on to become Premier, the first elected female Premier of New South Wales. Deputy Premier. Former Deputy Premier John Barilaro, who I came into Parliament with in 2011, has made a substantive difference. Look at Monero today compared to where Monero was back in 2011. That clearly demonstrates the impact of strong national leadership in this government, and that was delivered by John Barilaro, who rose to be Deputy Premier of New South Wales, and then Andrew Constance in Bega has also served for many years the Bega electorate incredibly well. Substantial, he's advocate. I know as the former Treasurer, dealing with Andrew was never easy because he was in there banging a hand on the table, getting more, arguing, articulating the case for more funding for the Bega electorate. And I know that's exactly what Fiona Coppoy will do. So I want to thank those outgoing members, and also Jodie McKay, who obviously is the Labor leader of the opposition, has served for many years in the Parliament, either up north in Newcastle, but in Stratford as well. People get in the public life to make a difference to their communities. She certainly did that, and obviously rose to being leader of the opposition. So whilst tomorrow is a new day and a new opportunity for members coming forward, I think it's a day to reflect on as well the great service of those members who are leaving the Parliament.
Premier, obviously you've got it's a very optimistic sort of opening of vision that you've got here. If we take all of the restrictions off and we go back to work and no masks in the office, when we get another wave, do we not just have the exact same thing happen again, where we have hospitals overwhelmed?
Great question. Great question. This is we discussed this at National Cabinet yesterday because for the last, if we go back a couple of years when it's the fear of the unknown. We didn't know when the first wave, when COVID began, where we were going to go. or how bad this was going to get. I remember sitting down in those meetings with Kerry and Susan, and those graphs, those curves were a lot higher than they are today, and we achieved a great thing in minimising the transmission of COVID. Then we had Delta, and we ran an incredibly strong vaccination campaign in our state. And then we had Omicron, the highly vaccinated population. There was a transition period as well, with a highly transmissible variant, but not as severe. And we don't know what's going to come our way. We don't. What we do know is vaccinations work. What we do know is boosters work. I think we have to expect further waves as we move through, but we need to stay the course. That may mean at various points in time adjusting our settings as we go through, and we need to look at what that could be. How do we deal with further waves going forward? These are the discussions as we move through this wave, which we will have, because we need to prepare for the next wave. We need to prepare for what could be difficult. But at the same time, we need to join the world and face into the virus and get back to life and move through. But that may mean that from time to time there may be restrictions that need to be in place, but they don't need to be as significant as we've seen. But over the last 2 years, we've got to stay the course going forward. We've got to stand strong as a nation, like they are standing strong in many countries around the world and getting on with life. That's been more of a challenge. That's been more of a challenge in Australia. It's been more of a challenge psychologically as well, because we pretty much eliminated the virus. We pretty much eliminated it, whereas they didn't have that opportunity. You look at the death rates around the world, we didn't have that. We didn't have that because, let's be frank, the natural geography of our great country allowed us to close borders and ensure the virus didn't spread and was kept out. But ultimately, this virus is not going away. It's going to be with us for a long time. We have to plan for that. There'll be different waves, there'll be different variants. But the best thing we can do, and what's in our control and what's been our success, has been vaccination and boosters. So we continue to do that. We'll work through. But Ursula, we're going to stay the course. We're going to stay the course because the alternative is the wrong approach, and that's the Labor lockdown approach. Because lockdowns means people lose confidence, people lose jobs, businesses close. That is the wrong approach. We've learned so much during this time. Yes, other issues will come our way, potentially other waves, potentially other challenges. But it's a time for our country to stand up, rise up, face into this virus and beat it and win and get back to the life that we love. And that's exactly what we're going to do in New South Wales.
Premier, off this mobile response.
I don't know.
Premier, you keep saying that New South Wales has a strong healthcare system.
Yeah.
3 weeks ago, I was delivering babies at a major hospital in Sydney, and what I saw there, I would not necessarily describe it as a strong system. We constantly needed staff, we were short of staff were stressed, burnt out. I myself I almost broke really, and as much as I love the profession, I just had to leave it because, because the system was weak. You already know next week the nurses and midwives will be striking. They need answers. They need a plan going forward. What is that plan? We need a plan.
Well, it's disappointing that you said you've left the profession, and I think we were out yesterday at Combane Stadium with many nurse graduates. There's 2,800 new nurse graduates that are starting right across our state, and a third of them starting in regional New South Wales. This is not a unique issue to our state, but we do have a very strong system. I'm sure it's under pressure. It's a 100-year pandemic. There's going to be pressure on the system, and we'll continue to work with the union in relation to their concerns, and where we can find opportunities for resolution, we will. I know the health minister is working on it, but we've invested more in our health system here in this state than any other state by a country mile. It's not even close. It's not even close. and that means not just more hospitals and health facilities. And since coming to office, we built 170 hospitals and health facilities across the state, and we're building 110 more. I think it's the other way around, 110, 110. And it's also the substantial investment in our frontline health service. Our frontline workers, 8,300. I think it's 8,300 since coming to office. Now they're big numbers. Behind them are frontline workers who are the heroes of the pandemic, and I thank them for everything they do. They've worked tirelessly for 2 long years, and it's likely that will need to continue. So whatever we can do to provide further support, we will. We always have a very constructive relationship with the union. Don't always see eye to eye, and we're never going to, but where we can find opportunities for resolution and work together, we will do that. I know that the Health Minister, I was speaking to him late last night in relation to discussions with Brett Holmes to continue any work that he can do in relation to that space. Then if we can achieve an outcome, that's positive.
Premier, just a final
question. Optus mobile phone reception, Premier, I can guarantee you the customer's not flush. Is Gladys Berejiklian the right person
Sure she is.
to head up Optus?
For sure she is. I think she's, I saw the news earlier today, and I wish her incredibly well. I think she'll, Gladys Berejiklian will be an asset in any organisation. She will be, not only is she a strong leader, but she achieves great outcomes, and her professionalism and her diligence will serve her very well. It's a great pickup. And if you've got an issue with Optus reception, you've got Glad's number. You can give her a call.
If it works.
If it works.
Didn't
Well,
miss a tunnel the other day.
Well, I think Telstra will be worried today. Kenny.
It's fine. I think it's been covered. Thank you so much.
All right, thanks, guys. Thank you. But I had voted for a while